This is Speaking of Health, brought to you by St. Vincent Health.
I'm Dr. Morgan Sauer. In today's Speaking of Health, we're going to talk about colon cancer, which is cancer of the large intestine. Sometimes this cancer is at the very end of the large intestine, at the rectum. Together, this is called colorectal cancer. Fortunately, many of these cancers develop over years in small clusters called polyps. These polyps may have no symptoms. With regular screenings and removals, colon cancer can be significantly reduced.
The colonoscopy itself is done. A lot of times you will find polyps. Now the polyps are then taken to pathology and looked at. Most patients should have a scope at 50 so that we don't find anything that we wish that we would have found that earlier.
I wish I had gotten it even earlier, and I'd like to tell everybody else they need to get colonoscopies.
I often have a lot of patients come in very confused saying, well, I never had any symptoms. These symptoms are often an advanced cancer if they have them. We can do some of the surgeries now laparoscopic, which is minimally invasive, which means I removed a rectal cancer from a lady that was just recently diagnosed and was able to remove it using instruments outside of the body and a camera, and a lot of times the incisions are minimal.
The problem I had was actually a mass in the cecum, which is the very right side end of the colon. He removed all of that and about half of the colon. And he did it all with just a few little punctures in the abdomen around the navel.
Another important point is that even if you are not 50 and you do have symptoms such as rectal bleeding, you should go to your primary care doctor and likely will need a colonoscopy for evaluation.
For more information on colorectal cancer, go to our website at stvincenthealth.com.
This has been Speaking of Health, brought to you by St. Vincent Health. Join us again next month to learn about another topic important to your health.